Hello, Dr. David Johnson's my name, and I'm from City Coast Neurosurgery, the Back Pain and Functional Movement Training Centre. This pre-consultation talk has multiple purposes. Obviously, I can't address every individual situation, but what I want you to take away from this leading up to our consultation are some principles about spine health. It doesn't matter if I'm seeing you for your neck or your lumbar spine or your thoracic spine for that matter, the principles are the same. The most important thing I want you to understand is that your pain symptoms have a cause. Back pain or neck pain is not a diagnosis. There is a disease that causes your pain, and if you never actually treat or cure that disease, you will never successfully resolve your pain symptoms. The best you will ever achieve, if you don't cure the underlying disease process, is short-term band-aiding of symptoms that may settle for a period of hours, days, weeks, or months, but invariably it will return. Now, I'm sure that many of you listening or watching will be experiencing exactly that. Weeks or months of pain. Some unfortunate people will have experienced years of pain, sadly. A question I want you to think about is, out of all the people that you have seen about your spine pain, who has told you or given you a diagnosis or a cause for your pain? Now, if you answer this honestly and are thinking that your diagnosis is old age or wear and tear, a bulging disc or a herniation, arthritis of your spinal joints, or because you simply strained your back at work and it hasn't got better, or because you do heavy manual work, you might be a labourer, or because you're inactive and you sit down all day in an office, or because you are naturally tight or you don't stretch enough, or because you're overweight, or you have scoliosis, or because you have a weak core, then you haven't been given accurate information. I've heard all the misinformation explanations, and that is exactly what these pseudo-diagnoses are, or pseudo-causes are. They are not causation at all. They may be associated with your condition of pain, but they are not the cause of your pain. Meaning, yes, you may be elderly, you may be overweight and sedentary, but that is not the cause of your pain. Because think about it, there are many young, normal weight, active people who also have back pain. For sure, if you have a fall or a lifting strain injury, that will cause pain. Just like hitting your thumb with a hammer, it hurts. But if you treat this injury properly, the injury should naturally heal. A tiny percentage of spine injuries require the addition of surgery to achieve comprehensive healing. The massive majority of injuries should be able to heal naturally and comprehensively and allow you to return to full work capacity if you engage in early effective rehabilitation. I'll explain that a little bit later. If you only do things like resting, stretching, massage, core strengthening, or only utilize symptoms focused on pain relief from medications or injections like epidurals, facet joint blocks, or nerve root blocks, then it's highly likely the pain symptoms will persist or relapse. It's a little bit like you're picking at a scab on your skin. There's a little bit of healing, and then you pick at it again and it starts bleeding and hurting again. This is the classic relapsing, remitting pattern of back pain that so many people experience until it becomes chronic. Chronic meaning pain every day. You just experience bad days and worse days. There are no good days anymore. Typically, relapsing and remitting back pain progresses towards chronicity. Well, how prevalent is back pain in our society? You're not alone here. It is one of the leading causes of disability on the planet, and the Australian Burden of Disease study was published late last year, and it highlighted some very concerning statistics. Back pain is second only to cancer and coronary artery disease in terms of total burden of disease and disability adjusted life years. And what's more, it is increasing, not getting better. The back pain therapeutic industry is getting worse at treating this condition over time. And there are around 35,000 registered physiotherapists in Australia and thousands of other therapists like chiropractors, Pilates instructors, massage therapists, fitness instructors, exercise physiologists, all of them seeing people with back pain. So why is it such a problem? And what's more, why is it getting worse? And note, it is not restricted to just older age brackets. It comes down to one fundamental concept that I'm almost certain you will not have been taught: structure and function. You will no doubt have spent much of your time addressing the structural elements of your spine, like the muscles, working on your core and manual therapy, massage, deep tissue release, ligaments and tendons, possibly with some prolotherapy or dry needling. You'll have worked on your joints with facet joint blocks, your nerves with nerve root blocks, your discs, possibly with surgery or epidural blocks. These are all structural focused interventions. You've probably modified your lifestyle to rest all of these structural elements of your spine in order to gain some symptom relief. But still, you're likely to be feeling pain, or when you get back to doing what you want to do or need to do, like going to work, you get pain symptoms that again limit you. I'm almost certain that you have spent very little time talking or thinking about the function of your spine. Function is the huge black hole, uncharted, untreated, and ignored in most treatment regimens. Improving patients' function in a timely manner is the key factor to cure the disease-causing back pain symptoms. If we think about a joint and the surrounding periarticular soft tissues that control that joint, the most significant factor that determines the health of that joint is its biomechanics, or simply the way it moves. So in terms of spinal function, the essential requirement to maintain or restore spine health is quality, skillful, proficient spinal joint movement. The primary purpose of a musculoskeletal joint is to move. If we have a joint that is not moving well, it will, without question, be unhealthy. This takes a variable period of time to occur. Instantly, as in the case of an accident, falling down the stairs or tripping over, or over many years, simply doing trivial activities of daily living. The end result is the same, however: an unhealthy joint or joints. The spine is made up of lots and lots of joints. The patient, or you, therefore, by definition, suffer from a disease that we can call movement dysfunction. So if you suffer from movement dysfunction, i.e., you don't know how to move your spine skillfully, you will progressively develop spine-related pain. And if you have an accident or strain injury, you will not be able to recover comprehensively from that injury. The other important point to note is that once you start to feel pain, it feeds forward to cause more dysfunctional movement. And you get caught in a vicious positive feedback loop, getting deeper entrenched in pain. A bit like quicksand. The more you struggle to get out, the deeper you get. The only true way out of this cycle of movement dysfunction causing pain and pain causing more movement dysfunction is a two-pronged attack. Of course, we treat the pain symptoms expertly, and yes, rarely we do need to alleviate compromised structural elements of your spine, but that is dependent on how long and how severe your movement dysfunction was before presenting. Of utmost importance, however, is that we simultaneously treat the disease of movement dysfunction. I'd like you to understand that treating movement dysfunction has nothing to do with stretching, strengthening, fitness, activity levels, or core strength. Massage and deep tissue release and manual therapy will never improve movement dysfunction. It does, however, have everything to do with skillful movement for all your activities of daily living, be they physically demanding or trivial. To treat the disease of movement dysfunction that is causing your persisting symptoms of spine region pain, you must know what the definition of good movement is, so that you can avoid poor movement. You need to be given the rules of moving well, and you need to implement them into your daily life movement activities in order to restore your spinal joint health. In many ways, it's no different to knowing the rules of how to drive your motor vehicle. In many ways, it's no different to knowing the rules of how to drive your motor vehicle well in order to avoid a car crash. Driving the much more important and precious human vehicle well will ensure you don't damage your musculoskeletal system and your spinal joints. When you have learnt the skills of moving well, your 24/7 daily life activities becomes your rehab program. A 24/7 rehab program like this is unique and incredibly powerful at restoring spine health. So now, reflecting back on all of the rehab and interventions you've done previously, how many of you can honestly say you have been educated, coached, or guided towards moving skillfully? If you have, then you should be able to write down easily what the rules of skillful spinal movement are. Can you? I'm almost certain you can't, so I will tell you the rules for human vehicle movement. Remember, it's just like the rules for a motor vehicle moving. Keep on the left-hand side of the road, indicate when you're turning, stay within the speed limits, etc. This keeps you safe in your car. There are 5 simple rules that keep your human musculoskeletal vehicle safe. Number 1, hip-centric rotation. Number 2, awareness of neutral spine positions. Number 3, unloaded knee positions. Number 4, posterior kinetic chain powered movement. Number 5, proficiency limited range of motion. These 5 rules are based on fundamental biomechanical principles of joint health. Although it appears overly simplistic, application and skillful expression of these biomechanical principles in a timely manner has the ability to unravel the complex quagmire that chronic spine and back pain on face value appears to be. A condition that so many patients, therapists and doctors alike have failed to cure because of a preoccupation and focus on structure and symptoms and an ignorance of causation and function. Cure the disease of movement dysfunction and cure back pain symptoms forever. Now, there are additional educational videos on this channel, so please watch or listen to them before your consultation with me and before your NeuroHab functional movement therapy. There are other important concepts that I haven't covered here, and two important additional concepts relate to centralization of pain, or central functional pain versus peripheral structural pain, and the functional capacity versus functional demand relationship. You will be able to find those videos on this platform, and to keep up to date with further videos, feel free to subscribe to the Functional Movement Training Centre YouTube channel. I look forward to seeing you soon, and all the best in your journey to recovery and a robust, pain-free spine. I'm Dr. David Johnson, spinal neurosurgeon and NeuroHab functional movement therapist from City to Coast Neurosurgery and the Back Pain and Functional Movement Training Centre. Thank you for listening.